Welcome to episode 3 of season 2 of Clot Conversations from Thrombosis Canada. I'm David Airdrie, Executive Director, and welcome to our co-hosts, Dr. Maha Othman from Queen's University in Kingston and Dr. Jamil Abdurrahman from Toronto General Hospital as co-hosts. We're excited to be back again and welcome to you both.
Great to be here.
Good to be back, David.
And we're here to provide you with updates on diagnosis and management of thrombosis, featuring interviews with authors of recent research publications and highlights of education programs from Thrombosis Canada. Thank you for joining us for this episode.
In this episode, we'll be discussing a recent series of articles from the Canadian Oncology Nursing Journal on cancer-associated thrombosis called Spot the Clot.
And we are very pleased to have two of the co-authors of this series with us today, Laurie Sardo and Julia Bayadinova from Hamilton. Laurie Sardo is a nurse practitioner in thrombosis service, Department of Hematology at St. Joseph's Healthcare in Hamilton. She graduated with her nursing practitioner program from McMaster University in 2014 and her doctorate in nursing practice from DUval University in 2022. Laurie's thesis work focused on patient VTE education in the high-risk cancer population. Her professional interests include patient and staff education and remains active on a number of educational interest groups, including Thrombosis Canada Patient and Family Education Committee, the ISTH Nursing Committee, and the US-based Anticoagulation Forum. Julia Bayadinova is a nurse practitioner specializing in thromboembolism. She's serving both inpatient and outpatients at St. Joseph's Healthcare in Hamilton. And in 2014, Julia graduated from Ryerson University with a combined Master of Nursing and Primary Care Nursing Practitioner program and has since found her passion in thromboembolism. Her research interest lies on patient education. Julia is currently in pursuit of Doctorate of Nursing Practice degree at Post University and is completing a thesis on the importance of patient education. Thank you both for participating in our podcast today, and we'd like to get right to the questions. So I'm curious in the beginning to ask, what was the inspiration behind the Spot the Clot series?
Yeah, so this series was somewhat of a nursing spin on Thrombosis Canada's Stop the Clot campaign. So in our clinical practice, we noticed that patients with newly diagnosed cancer-associated thrombosis were not aware of the link between cancer and blood clots. Many of these patients expressed surprise and, a bit of frustration that they were at risk in the first place. And our observations in practice were in keeping with the literature on this topic, in that oncology patient education does not emphasize the risk of VTE or its signs and symptoms. So, most of us are familiar with Dr. Simon Noble's Pelican study series, which concluded that there's a general lack of awareness of cancer-associated thrombosis among cancer patients. We reached out to our thrombosis nursing colleagues across Canada for an informal discussion, and many of them actually shared similar experiences. We have to actually give a shout out to our co-authors, Jill Scott, Susan Jenkins, Vanessa Higgins-Nogarita, Lynn Penton, and Brooke McKinnon for their contribution to this series of articles. And this was initially intended actually to be a single article, but given the volume of information we wanted to share, it just made sense to highlight an overarching theme in each of the articles. And so our intent was to raise awareness of cancer-associated thrombosis in oncology care providers, thereby empowering them to address the topic with their patients, with the ultimate goal to improve patient care.
Okay, so what is the current status of awareness of cancer-associated thrombosis in patients today?
That's a great question, Jamil. And as Laurie stated, this was the inspiration behind the Spot the Clot series. Our literature review was actually consistent with our clinical observations in that patients generally have a pretty low awareness of cancer-associated thrombosis. And this includes the link between thrombosis and cancer, as well as its treatment or surgery. We also pretty often see that cancer patients are not really familiar with common signs and symptoms of thrombosis, which of course means they often delay seeking medical attention for assessment and diagnosis. Unfortunately, this results in their burden of thrombosis now being higher and patients being quite symptomatic when they do present. Obviously, at later stages, treatment and symptom management becomes a lot more complicated, and patients may require longer hospitalization or even have worse outcomes. We've actually collected some data at our institution that also supports these findings. Laurie did a small study as part of her doctorate thesis looking at the awareness of cancer-associated thrombosis in a thoracic surgery clinic, where a high proportion of patients have a cancer diagnosis. And only 10% were aware of the increased risk of VTE in patients with cancer. Obviously, we had known that there was a lack of awareness in patients, but we were quite shocked at the actual number. The significance of 90% being unaware of the risk is obviously really disheartening, and it's a desperate call to improve patient care.
So this is really significant. I fully agree with you. And we're now going to ask, why do you think it's important to improve patient education on cancer-associated thrombosis? And particularly, what are the areas that lack awareness?
So first of all, a knowledgeable patient is an empowered patient. In his Pelican series, Dr. Simon Noble found that one of the most frustrating aspects of the diagnosis of cancer-associated thrombosis for patients was that they had no idea this was even a risk in the first place. So not only are patients unprepared to deal with the mental burden of VTE, but this lack of awareness often results in patients misinterpreting their symptoms for cancer progression or side effects of their treatment. They may not report their symptoms thinking they're a normal part of their disease trajectory, which again inevitably delays treatment and even diagnosis. And obviously, this can hinder their outcomes and unfortunately sometimes results in their demise, because we know from prior studies that VTE is the second leading cause of death in cancer patients, second only to cancer itself. So raising awareness of cancer-associated thrombosis may empower patients to be vigilant for concerning signs and symptoms and to address this topic with their providers too. Some of the most important topics to address with a newly diagnosed cancer patient are what VTE actually is, including explaining what a DVT is, what a PE is, as well as its increased risk in cancer patients. Patients obviously need to know the common signs and symptoms of DVT and PE, and that they should seek immediate medical attention if any of these symptoms arise. Even if some of the symptoms of VTE are present at their baseline, for instance, lung cancer patients often have shortness of breath. They will sometimes have chest pain, but they should know that sudden or progressive worsening of their symptoms should be evaluated without delay. And actually, the clots handout that's available on the Thrombosis Canada website is a great resource for teaching patients about signs and symptoms of VTE. It's very concise and to the point, and this is what we routinely hand out to patients at risk of VTE on hospital discharge.
Okay, great. So you mentioned the clot patient handout. What are some other strategies for improving patient education on cancer-associated thrombosis?
So our second paper in the Spot the Clot series was entitled What Cancer Patients Want to Know, and actually focused on this particular question. There are a couple of important points, I think, to keep in mind. First, we need to be mindful of a patient's health literacy level and ensure, that our strategies are somewhat individualized. I think it's important to recognize that the majority of cancer patients are over 65 years of age and therefore more vulnerable to both cognitive and sensory impairments. So ensuring that the patient is able to hear and understand and, perhaps have a support person as a second set of ears is really quite helpful. The basics of patient education, of course, suggest grade 5 or 6 reading levels for written materials and a variety of teaching methods to facilitate understanding. The second important point to consider here is a patient's readiness to learn. Perhaps at the time of a cancer diagnosis, when the patient's already overwhelmed and devastated, may not be the best opportunity to provide extensive education on this topic. It may need to be revisited and reinforced at a later time, even if, they seem to understand and retain that information that you've provided them. A small RCT that we actually conducted at our outpatient thoracic clinic here at St. Joe's focused on the effectiveness of patient education and the impact that different teaching modalities may have. And we compared a one-page handout on cancer-associated thrombosis, including signs and symptoms of CAT. We compared that alone or in combination with a short animated video. And we were pleased to find that there were significant improvements in both patient understanding and awareness in each of the groups. And interestingly, a patient's basic level of formal education had no impact on their ability to learn. So patients with high school or less formal education demonstrated similar improvements to those with post-secondary education. In addition to our findings, patients randomized to 2 different educational modalities demonstrated a greater improvement. So that was an important takeaway. So this suggests that patients provided with materials that are easy to understand improve their knowledge and awareness regardless of their formal level of education. And this benefit was amplified with more than one type of educational material. So written and video materials may accommodate different learning styles people have and also reinforce that information that they're provided with.
Well, thank you for sharing this valuable insight and highlighting some of those special strategies. Now that we talked about the patient, I'm wondering, what are your thoughts on the current status of awareness of knowledge gaps of cancer-associated thrombosis, but among healthcare providers?
This is a really interesting topic, and actually one to which we dedicated the 3rd article in the series. Unfortunately, healthcare provider awareness is not as good as we might expect. And several studies addressed this topic, and pretty much all of them found that there is a significant knowledge deficit among multiple groups of different healthcare providers. This includes oncology nurses, pharmacists, general physicians, and even oncologists and hematologists. And similar to patients with cancer, providers may attribute signs and symptoms of VTE to cancer progression or treatment side effects, which is not surprising because, of course, symptoms may be so similar. And I'll provide a couple of examples from the literature. In oncology nurses, for example, there are a lot of misconceptions about cancer-associated thrombosis. And although a large majority of the nurses are aware that VTE is a common complication of cancer, many of them downplay their own role in the diagnosis of VTE, which is very unfortunate because nurses play a huge role in that. Their VTE assessment skills are also lacking, but not only because of gaps in knowledge, which were quite prevalent, but many actually reported that they lack the time to actually conduct a thorough assessment as being the main reason. And of course, we know that time deficits are now even further exacerbated by the post-pandemic nursing shortages. So unfortunately, we're in no better shape than nurses were in the studies that were conducted. Even more surprising were the findings of a couple of studies aimed specifically at oncologists. And although the general awareness of cancer-associated thrombosis was excellent, not surprisingly, there were still some knowledge gaps in both risk factors of cancer-associated thrombosis as well as treatment of the disease. We were a little bit surprised at finding those articles and reading the results. And of course, all of these literature findings support a need for greater emphasis on targeted provider education so they can empower their patients.
So what are the important items for healthcare providers to know about cancer-associated thrombosis? And are there specific strategies for improving healthcare provider education on cancer-associated thrombosis?
Right. So, first of all, I think providers need to understand what cancer-associated thrombosis is, along with the impact it has on patient quality of life and, of course, mortality and morbidity. It's important, again, to recognize that the highest VTE risk is in the first 3 to 6 months after cancer diagnosis. So, decisions to postpone the discussion with patients can actually be detrimental. Some important risk factors for providers to consider include the location of the primary cancer, because we know certain cancers are associated with a higher VTE risk, like pancreatic, uterine, and lung cancers. Other risk factors, of course, include chemotherapy, the presence of central lines, the surgery that patients may be having, and of course, their immobility risk. So, strategies for improving healthcare provider education have been studied in the literature, and implementing risk stratification tools such as the Corana score into electronic medical records may help to identify these patients at high risk of thrombosis. In addition, including objective assessment components in outpatient nursing documentation may serve as an additional tool for identifying possible red flags, leading, of course, to hopefully an earlier diagnosis of VTE. And it's interesting here, strategies that were shown to be effective at increasing patient awareness actually had the same effect on healthcare providers. So, for instance, a video on cancer-associated thrombosis that was playing on repeat in our oncology waiting room actually increased the awareness of the topic in nurses, and at one hospital triggered a revision of their patient education materials to then highlight cancer-associated thrombosis.
Well, thank you for this. It's obviously very important to get that nursing perspective on this important topic, and it's interesting to hear what you had said. So we're coming close to the end of the interview, but I'm from someone who is involved in nursing education and nursing student education in particular. I'm curious to hear from you. What is the role of oncology nurse to support advocating or advancing the knowledge of patient care around cancer thrombosis, cancer-associated thrombosis?
That's a really important question because we know that oncology nurses, especially in the outpatient setting, maybe chemotherapy settings, are often the most common point of contact with the healthcare system and a patient's care and their cancer journey. Nurses are often a source of support and may even offer a gateway to rapid assessment by oncology specialists. So we think that with proper education and tools at their disposal, oncology nurses could play a key role in improved patient care. This includes identification of signs and symptoms of VTE in the patient, as well as communication of these red flags, both of which will hopefully lead to a more timely diagnosis and treatment of cancer-associated thrombosis. And as mentioned earlier, implementation of subjective and objective assessment measures into the nursing workflow could potentially help with all of the above, but also serve as a trigger to remind patients to be vigilant for concerning signs and symptoms at every one of their outpatient appointments. Another point to consider is that we know from prior studies that adherence with therapy increases when patients demonstrate a better understanding of their disease and treatment. And ongoing patient education has been shown to increase adherence, specifically with injectable anticoagulants in cancer patients, and even improve their quality of life. And we know that nurses are a vital and trusted source of information for both patients and their families. So including the topic of cancer-associated thrombosis in routine educational sessions is absolutely essential in raising patient awareness of VTE.
Thank you.
Okay. And is there anything else that we haven't discussed today that you'd like to add?
I guess we'd like to conclude with 3 takeaways here. The first, cancer-associated thrombosis is not a rare phenomenon. In fact, it's the second leading cause of death in patients with cancer, as we all know. Second, VTE can be fatal, and teaching patients about signs and symptoms of VTE can alert them to seek medical care sooner and of course, improve patient outcomes. And finally, cancer-associated thrombosis can be a very distressing experience for both patients and their family. But by being aware ourselves and making them aware, we can hopefully help make their journey a little bit smoother.
I agree. And I'd just like to take this opportunity to thank our Canadian nursing colleagues who contributed to the Spot the Clot series, and of course to Thrombosis Canada for inviting us here today to showcase this important topic.
Appreciate your thoughts.
Thank you both for participating today. It's great to have you on board and to discuss this important topic. I'd like to thank our audience for listening to Clot Conversations from Thrombosis Canada. We welcome your comments, questions, and suggestions on the podcast. If you have any recommendations for future podcasts, please send them to us at info@thrombosiscanada.ca. And please subscribe to this podcast so that you are notified about the release of new episodes. Don't forget to check out our website for education programs, clinical tools, and guides, including materials to support education and awareness of cancer-associated thrombosis. Also, please consider donating to Thrombosis Canada to support our ongoing efforts to reduce morbidity and mortality due to thrombosis. Thanks, everybody.
Thank you.
Thank you.